G'day, it's Paul. This is a thyroid case. It's from a 74-year-old female who had a TIRADS 4 lesion in the right thyroid, and it was described as a large cystic structure. See what you think. So what's your diagnosis? The specimen was highly cellular. Really couldn't identify any colloid present, but there were numerous cells present that form kind of loose groups, as well as being single. Some of the groups were quite vascular as well, with vessels around them. Cytoplasm was really either absent or very scant and very indistinct. Nuclei were round to spindle in shape, some of them quite elongate, and some of them were stacked almost like in curious little moulded arrangements like stone cans. The chromatin was pale, maybe a little stippled, and there certainly weren't any prominent nucleoli. There were longitudinal grooves present, and there was also quite a lot of intranuclear cytoplasmic inclusions or INCIs present, and in some cases these were multiple in the nuclei. In terms of diagnosis, medullary thyroid cancer was certainly the most likely. It lacked any follicular pattern, and there was a lack of papillary architecture present, even though there were some papillary-like nuclear changes present. The nuclei, however, really fitted with neuroendocrine cells. They varied from round to oval. The chromatin pattern and absence of prominent nucleoli fitted with that as well. Differential diagnoses for this are pretty wide, but certainly include a metastasis, like maybe even a melanoma, or other neuroendocrine tumour, maybe a carcinoid. Features that have been described with medullary carcinoma that we didn't really see include amyloid, maybe sometimes a more dispersed population, and certainly sometimes a more plasmacytoid cell configuration, but this is really highly variable. Sometimes rosettes can be seen, and red cytoplasmic granules are sometimes seen on Romanowski stains. INCIs are not a particularly typical finding of medullary carcinoma, but they've been reported in about probably 20% of cases. Some cases of medullary carcinoma can produce follicular structures cytologically and have rosettes clustering around amyloid, and they can also sometimes mimic thyroid papillary carcinoma, with intranuclear cytoplasmic inclusions being common like this one. We attempted a cell block on this, which was proved to be very scanty, but it showed some spindle cells present, and these were positive for calcitonin, TDF1, synaptophosin, and chromogranin A. So the specimen was reported as a category 6 malignant, consistent with medullary thyroid carcinoma. Patient proceeded then to a thyroidectomy, and this confirmed medullary thyroid carcinoma with focal lymphovascular invasion. Lateral net dissection was performed, and this showed metastasis to 5 out of 8 nodes that were sampled. So thanks for watching.